Okay, this is how the content will be delivered. Just remember, patients will remember the information when it's presented verbally as well as visually. They just tend to better remember simple concepts as well rather than complex concepts. So, as us as doctors, we have to keep things simple um, and less complex as much as possible. So, to get started, all you're going to do is press and hold. You're going to open in Pages. It's going to bring up, it's going to upload the file for you. Now remember, you got to have the Pages application, which is $10. You can find that in the App Store. Pages allows easy use with the iPad. You can create a PDF file or a Word file. Pages just tends to work with the Apple system a whole lot better. So today we're going to be talking about the glaucoma brochure. The glaucoma brochure now, we tend to see on average more than 20 patients a day. And when we're seeing about 20 patients a day, that tends to leave us about a 10 to 15 minute exam with very little time to appropriately educate. So this brochure really allows us to make a significant increase in patient comprehension as well as understanding. Um, so marketing simply tells us to present information verbally as well as visually so the patients can better understand these new ideas. So as it pertains to glaucoma, what is it? The questions patients are asking is, how does it affect vision? You can see on the first page there that this is a very easy, clearly easy to understand concept there. This does a whole lot more than words. Oh yeah, glaucoma just affects your peripheral vision. This is a visual cue to give them a much better understanding. As we scroll down, we get a little further. How does it affect the eye? Now, this is where doctors tend to get very, very complex. Again, we're trying to keep it simple. So as you can see, we got a picture of a normal looking optic nerve. That's what glaucoma affects, is in essence damage to your nerve. How does it affect the nerve? What causes the nerve to become damaged? Pressure. Pressure increases in the eye, damages the nerve tissue, and causes it to look like that. Again, you almost don't even need any words to describe what's going on here. The visual cues provide you with as much information as needed. Now, some patients need a little bit more information, so then we're going to go on to the RNFL maps. We know that through mapping the retinal nerve fiber layer, we can detect glaucoma a little bit earlier, and many times this precedes any type of vision loss. Now, let's just say you do not have the OptiView RT view there. Say you have the Stratus OCT. It's very simple to work with in this system. You're just going to click, hold. Now that's if you want to mask it. You can basically pan out, pan in. Very easy to work with. Let me go back here. So let's say we would just want to replace this image. We're going to click replace, and let's say we want to go with the Stratus OCT document. We're just going to click and put that in there. I don't like that. That's an older technology. I'm going to go with a more updated RT view to use for this demonstration here. Now, getting to the last page, it just basically talks to patients that are verbal and like to read. Some people just simply like to read to learn more about the information. There's plenty about glaucoma right here. Again, you don't want to get too far into detail. Just try to keep it as simple as possible for them to comprehend and understand what's going on. It's also very important that you do include a little photo of yourself, because patients tend to remember faces rather than names. Just a very easy way for them to recognize you, as it pertains to glaucoma. You also want to include your address and phone number there. Very easy to swap out. All you're going to do is click and hold. It's going to say replace. Again, you're going to click replace. And let's say I wanted to just simply add me and my wife. You're just going to add that. Boom. Very easy to work with. Same thing with the logos. You're going to want to add your logos. You're going to click replace. And again, you're going to just upload your file in a JPEG. Now, printing the document will look like this. This is a printout of the document. I would tend not to print it out. This is the other page. I would tend not to print it out because it is a digital copy, you can simply have them save the money on the paper. So you're going to simply have them view this on the iPad in your waiting room. Create a PDF file is very easy. All you're going to do is click on that, share and print. Let's say you want to email the document in a PDF format, a Word document, or what you were currently working in, the Pages format. You're just going to email that. Printing is the same way. You just need to have an Air printer. Again, very easy to work with. The iPad gives you the freedom of working when you are out of the office, which is where most of our creativity takes place. These great ideas do not tend to come to us when we're in the middle of seeing 30 patients a day.